At the Health Medicine Center in Walnut Creek, we have healthcare practitioners of multiple disciplines that work together for the benefit of the patient. It's called integrative medicine. And so I was really pleased to see this study that just came out that showed how well naturopathic medicine works together with conventional medicine in helping patients with type 2 diabetes.
Yeah, it's a good thing. You know, back in 2004, it was very interesting. We were trying to get the naturopaths licensed in California because they had been trying for about 15 years unsuccessfully because the doctors simply didn't want to give up that turf. No, we do wellness and prevention well enough. We don't need naturopaths who aren't trained the way we are to be able to do it. And now what we find out, here's an article that comes out and says, okay, naturopaths are now joining doctors in patients who have type 2 diabetes and adding to what they're doing. And is it making a difference? The answer is it is making a difference.
The patients are learning much more about their disease, and they're feeling in more control, and their moods are better because of it, and their symptoms are better because they're living a healthier lifestyle along, you know, with the counseling that they're getting. Many times medical doctors don't have time to do all the counseling.
Well, they don't take time to do it, and in this economic system that we have, time is money. So it's good to see that we were right back in 2004 and that naturopaths are licensed and that they're looking at the lifestyle factors that are important for diabetes or to control type 2 diabetes. What we do in Western medicine is use a lot of drugs and technologies. We treat the complications when they come up. We treat the heart attacks, the strokes, the peripheral vascular disease, the retinopathy, the nephropathy, the peripheral neuropathy. We're good at treating all those things.
And some of those things we aren't good at treating, though.
Well, we do better than if you didn't have doctors. The doctors do some things that the whole point here is that the approach is not right. We should be going after the cause and preventing that. So we should be doing the lifestyle things that are the key parts of naturopathy.
Well, much of diabetes can be controlled with a healthy lifestyle. That's the diet and the exercise and the stress reduction and getting enough sleep and you know, having a purpose in your life.
Right. So if we're looking for real healthcare reform, we should be looking at we can save money by doing things that are preventive, first of all, and there's so much arguing going on that's nonsensical arguing, because who's doing the arguing? It's the people who have an investment in technologies and drugs who say, no, prevention and wellness won't work, and it's the people in wellness and prevention saying, we've done a few studies, read them, and you've got to a place where there's an impasse.
And a lot of the drugs that diabetics take have a lot of unhealthy side effects.
Like try more heart attacks and strokes, okay, the very things we're trying to prevent. So it's not like using a drug is the ideal way to do it. So this article that was published in Biomedical Central Complementary and Alternative Medicine Journal that looked at how naturopaths add to what we're doing makes the point, one, we need to look at the fact that we have naturopaths available and use their services. Second, know that the approaches they're taking that are boosting lifestyle advantages that we need to do. And third, don't have the complications of the drugs that we're using is the way to go. And that's how healthcare reform should be couched. And I hope that that's what happens sometime in Congress when we don't have all this political corruption and conflict of interest, which seems to be the rule of how Congress works.